catch them as early as possible. Remember, as the age progresses, if you catch autism late, there are chances that you will not be able to treat them properly. So it causes problems functioning in the society, socially, in school and work, for example. Often children show symptoms of autism in the first year. A small number of children appear to develop normally in the first few years, and then certain things happen and they start regressing back. Now in homeopathy, this is very, very important because we have something called a primary autism and secondary autism. Many children are born with a lot of autistic symptoms and they may not speak at all, or they may not develop at all. But there are children who are developing normally up to certain age, up to the second year, third year, and then they start regressing. This is where you think of regressive autism, and that's where our rubric never well since can come into use, remember. So we have autistic children who develop autism or develop regression after the father left for his job, or some pet died, or his grandmother died. Something happened, some viral infection, some vaccination, some too much exposure to the screen. We have seen post-COVID, what is happening is more and more children are diagnosed with autism because of the too much exposure to gadgets, remember. Okay? While there is no cure for autism spectrum disorder, early treatment is important. Therefore, it's very, very important to educate our patients that if they know of a child like this, immediate treatment is whether allopathy, homeopathy, but start treatment as soon as possible. There is an alarming increase of ASD in India, and it is estimated that more than 60 lakh, 6 million children, people in India are affected by this abnormal condition. And this is post-COVID, remember, it has increased, right? Boys are more affected than girls. Causes of autism. Now initially we used to think of many other things, and therefore autism was something like iatrogenic, or the cause was unknown. But now post-COVID we have seen increase in gadgets. So too much gadget exposure, too much the visual stimulus and the hearing stimulus. They are overstimulated every time, remember that. So nerves are constantly working. The brain does not get chance to shed off the excess neurons. Now there is something called synaptogenesis. If you know, when the child is in the womb of the mother, there are a lot of synapses, and these are in form of network. What happens is, as the child grows in the womb, the synapses get broken up. That is known as pruning. Now imagine around 7th month or 8th month, there is a trauma to the mother. That trauma could be abuse from the husband, or a sexual abuse, financial abuse, any kind of abuse, which can lead to non-pruning of the synapses. And the child is born with all these synapses, which are like, the circuit is not proper. And therefore the child suffers from autism. Therefore mother's state of health during pregnancy is very, very important. It takes us back to our culture, Indian culture and many other cultures all over the world, that when the woman is pregnant, she goes to her mother's house where she's made happy, she's given all sorts of food to eat, nice pictures are put so that she's happy. This kind of happiness is so essential for the mother, remember that. And therefore counseling of couple is very, very important before they even plan to have a child. Because if there is such a situation at home, there are chances that the child may have autism or may get autism, remember. So vaccination is yet another, but don't blame the vaccine. Vaccine can cause regression, vaccine can cause autism, but all of us had vaccines, remember. But we never got autism. Therefore, there has to be a predisposition. There has to be some kind of a genetic predisposition plus the vaccine will cause autism, remember that. And that genetic predisposition in homeopathic world we call fundamental miasm. So treat the fundamental miasm and probably you will avoid the autism. Infections, consanguineous marriages, mother's health during pregnancy, and then hypoxia. Now one of my friends in Chennai, he started an oxygen therapy center, BART. That is the bariatric oxygen. And he feels that autism, the main cause could be hypoxia. And even after giving oxygen, these children have started developing better, which means that anoxia or hypoxia could be one of the factors of autism, remember. Therefore, our remedies like Carbo-Veg, Carbo-Animalis, all these remedies can be used, camphor, where there is a kind of collapse, remember. So, genetic predisposition plus environmental toxins will give rise to autism. You have to be genetically predisposed, then only you will get autism, remember that. There are three basic problems. One is the behavioral issue. The child is going to come up with a lot of hyperactivity. Once he enters into your clinic, how he enters is also important. Many a times the child enters first and the parents come afterwards. Many a times the parents have to pull the child inside. So the way the child enters in your clinic also is a PQRS symptom. You can take one of these symptoms to treat autism, remember. So behavioral issues such as hyperactivity, temper tantrums, poor attention span, decreased concentration and poor focusing. Secondly, there are issues with speech. Mostly the mothers will come to you with speech issues. And they'll say that my child was able to speak little words, but I don't know what happened, some infection, something happened, and he started regressing. All the words that he was able to speak, now he is not able to speak, remember. You have to find out whether it is a mild autism, moderate autism, or severe autism, because homeopathic prognosis depends on that, right? So speech, language, and communication issues are there. And lastly, skill impairments such as poor eye contact, which is one of the most tragic issue of a mother, that when the mother is calling the child does not even look at her. So poor eye-to-eye contact is a primary problem, remember. And in homeopathy, luckily, this is the first thing that comes back to normal. And the parents are happy. When your simulimum causes the child to look at the mother, child starts obeying the orders of the mother. Okay? Now there are certain tests that you need to do. One of the most important tests that we can do or we have to see is CARS. That is the Childhood Autism Rating Scale, which tells you whether the child is non-autistic, autistic, mild or moderate, or severe. So you have to see the score. Now whenever you treat an autistic child, you always need to do the CARS. Not only symptomatically the child should be better, but we should have a evidence-based practice whereby we have to show that even the CARS has reduced. So we have children where the CARS had gone up to 36 and after the similar remedy, it has come to 30 or 28, where the child became non-autistic, remember. So conversion of an autistic child to a non-autistic child requires evidence-based, remember. So one of the tests is CARS, which is very, very common. Next test is ATTEC, that is Autism Testing Evaluation Criteria. Third is VSMS. Just like there is an intelligent quotient, there is a social quotient also. So these three tests are the most important tests that you do or you need in. Now when you do the homeopathic approach, you need the homeopathic totality. How will you make the totality? Now the child is going to come to you with three patterns, remember, three basic patterns. First is the motor pattern. In motor pattern, you will see that the child is running all the way, hyperactivity is there, hyperventilation is there, he just cannot be stopped and the mother is going to tell you as if uske pair mein motor lagi hai. He is not tired, but I get tired looking at him. This is what the mother tells you. That's where you will think of our remedies like tuberculinum, tarantula, nux vomica, all those remedies. Then, alternatively, the child could come with sensory issues, whereby little noise and the child will put his hand on the ears. Or he will start banging. Remember, in autism, what happens is there are hypo or hyper functioning of senses. We have 7 senses. All these 7 senses, one of the senses can become hyper, another can become hypo. And these hypo or hyper senses are the source of rubrics, remember that. Some children like belladonna, commonly you see belladonna coming and making noise on the table. You see the rubric noise inclined to make. You have got remedies like belladonna, opium, veratrum. These are the remedies you can think of in these children, remember that. Okay? So the second thing is sensory. Some children like cuddling. Some children like kissing, like our carcinogens, phosphorus. Some children will detest cuddling and caressing, like Sina, chamomilla. So hypo and hyper functioning of senses, right? So there is intense sensory, and the third variety is regressive. These are the children who will take their saliva, apply on the table, lick it back, they'll pass stools, they'll eat their stools. These are the children with comorbidities. That means they may have Down syndrome, they may have mental retardation, they may have epilepsy. These are difficult cases. Even with homeopathy, you may not get the kind of result that you want. The best cases you will get in mild to moderate, where you can reverse, remember. Moderate to severe and severe are not very good cases. We can only bring them a little bit to normal, maybe to a normal school, stop eating the stools, then diaper, all these things, control can come. But you cannot bring the child to normal. That's what my experience is, right? So first was the sensory pattern, where stramonium, borax, asarum, theridion, carcinosin, nux vomica, opium and china. They are hypersensitive to different things, remember. Carcinosin child, thoda sa bhi shirt pe kuch gir jayega, he will start crying and he wants his shirt or dress to be removed. That means his cleanliness is there. Are you getting it? So he's very, very sensitive to dirt. So again, here is the sensitivity, hypersensitivity. So the child could be sensory or the child could be, now these are the rubrics you see. You see caressed, desire to be caressed, magnetized, cuddled, desire to, carried, desire to, kissing. These are the rubrics you will take for hypo-functioning of senses. Because when there is hypo-functioning, the child will always like to cuddle you, remember that. When there is hyper-functioning of any sense, the child will detest you, the child will throw you, the child will push you. Like in Sina, touch aversion to, caress aversion to, shrieking when touched, all these rubrics. So rubrics, what rubrics you can take in hypo-functioning and what rubrics you can take in hyper-functioning. Okay? Noise inclined to make. See, belladonna is in 3 marks and it is one of my best remedies for autism. To start with, remember. Now, belladonna child, as you all know, it's not always hitting, spitting, biting, pulling hair. No. Belladonna children are very, very sweet children. Belladonna children are very, very nice children, remember. Smiling children can be like that. Only when something is done against their wishes or if they are forced to do something, that is when we see the actual belladonna picture, remember. That you have studied in the books. Biting, spitting, pulling hair, all this comes later on, remember. Otherwise, belladonna is a very, very nice child. Okay, fine. Kinetic or motor pattern, I told you they could be very impulsive, running around. What are the remedies? Tarantula, Stramonium, Tuberculinum, Medorinum, Nux vomica. Medorinum, a very, very epitome remedy. Remember, there are 3 symptoms in Medorinum that I see in these autistic children. Number 1 is they sleep on their abdomen, remember. We have many remedies which sleep on the abdomen. Medorinum sleeps on the abdomen. Third, they are better at sea. The mother is going to tell you, जभी भी इसको समुद्र के यहाँ पे लेके जाती हो तो एकदम शांत हो जाता है, ठंडा हो जाता है. All his hyperactivity is reduced. Third thing, craving for sour fruits, green fruits. And fourth, another is craving for ice also in Medorinum. And the most important thing is, ये बच्चा रात में सोता ही नहीं है. He is very, very active in the night. That's Medorinum, remember. Based on these symptoms, we have given Medorinum to many children of autism, remember. So these 4 symptoms have to be there. Regressive pattern, where they are passing stools, think of Baraita, Buffo, all those remedies. This is the pattern that we have come up with. This is a very important thing. Sensory pattern, kinetic pattern, self-injurious pattern, and regressive. You can use this pattern. Now remember, patterns they come mixed. You have to see the predominant pattern. It's not that you're going to see a child with sensory only. You may see a sensory and motor, or a sensory and regressive, or self-injurious. One of the most important remedies for self-injury, people, going back and hitting their heads, think of lycinum. Very, very important remedy for self-injurious behavior. Autistic 7, very, very clever, intelligent children. More intelligent than any of our children, remember that. They can read books, they can draw, painting, and that's where carcinosin has been a very, very important remedy for autistic 7 children. So carcinosin, yet another very, very important remedy for autism. This is the history taking. Of course, pregnancy history is very, very important. Look at chapters ailments from for cause of regression. Temperament of the child. Sleeping position. Don't forget to ask sleeping position. How does the child behave in the waiting room? What does he do after entering? What is his reaction when you look at him or try to examine him? What if you offer him a toy or chocolate? The way he takes it, remember. Whether he grabs it, whether he goes back, whether he looks at his mother, all these things are very, very important. Sitting still, restless, obeying what the parents say, reaction of the child to what parent is talking, reaction. Let's see quickly a case. Give me 2 minutes, sir. Can we start this case, please? This case of Mikhail. Now he is not very hyperactive, but he is jumping. Now see, this is a characteristic jumping. Next. See, again he is jumping on the pillow. Now this is very, very important. He is not jumping on the ground. So this also has to be taken into account. Next. He is singing songs. Remember, the sound is not working. Otherwise he is singing songs. See the climbing. Again, can you see danger? No sense of danger. See, he's not afraid. He's climbing. आराम से चढ़ रहा है. डर नहीं लग रहा है उसको. There is no fear. Remember. So all these things, looking at the video of children is very, very important, especially in autism. Next. See what he's doing. He wears specs like a teacher and acts like a teacher. So one of the rubric taken here was imitation mimicry and also antics plays, because he was trying to tease everybody with these specs. So antics playing was the rubric taken here. Next. And when he was going to school, you cannot have the sound, but he's singing, okay? So we'll just see the follow-up of the case. Just go ahead, please. Next. So he's become quite okay, see, after the remedy, okay? Let it go. Next. Minimize it. So this is Mikhail Costa, 3 years, 9 months. These all symptoms were there. What were the symptoms taken? Banging his head on the wall, pulling my hair. This is the mother says. Throwing things, eye contact is there with us, strangers not. Does not sit in one place, sitting tolerance is not there, likes to play drums and make noise. So this was my eliminating symptom for the remedy, remember. Childhood autism scale was 32.5. Now remember, it is mild to moderate autism. The rubrics taken were playful. He was playing. Playful and play desire to. Remember, playful means people who can play only with themselves, even with the handkerchief, even with the paper. That is playful. Play desire to has, he requires somebody else to play with. These two rubrics come close by close, remember. So there are some common drugs in playful and play desire to, and there are some uncommon remedies also. Belladonna comes in both, remember that. Jumping, climbing, restless children, pulls hair, throws things, antics, imitation, noise, inclined to make, smiling and singing. All the rubrics were taken. And if we see, the first remedy coming is Belladonna. Out of the 10 symptoms, all covered 17 marks. Next remedy was Hyosamus. But Hyosamus is very jealous, very, very violent. This remedy was not. So Belladonna was selected, given in LM potency. LM1 twice a day for 15 days, followed by placebo, and see the result. Immediately within the first 2 weeks, you get 40 to 50% relief, remember that. And that's what a similimum can do. I usually give LM potency, which works excellent in autistic cases, rather than a C potency or a D potency, remember. Jumping is also less, head banging is less, speech has come, remember. Speech has become okay, and that's what parents want. बच्चा बोलना चाहिए, जो नहीं बोल रहा है वो बोलना चाहिए. He started singing, remember. Screaming loudly now. Eye contact is better, speech is better, head banging is 75% better. Prescription, I raised it to LM2, because usually LMs you raise. You can even shift from LM1 to LM3 or LM5 also, if the child is doing better. So I did LM2 again 15 days, now much better, and patient is still under my care. Belladonna LM3 is on now. So this is a case of Belladonna, right? Now this is only one last thing, 2 minutes. Mikhail was cooperative and listening. This is a psychological report. Completed all the tasks. Waiting has increased. Now this is a good thing. Now he is able to wait. Doing good sitting tolerance, waiting tolerance, giving good eye contact, name response, waiting, increase to do, good in instruction. Now this is the thing that we want. The psychologist has given this. So psychologist has told us, okay, the child is improving. And this is what we as homeopaths need. Not only symptomatic, evidence-based and psychological tests. Okay? So thank you very much. Okay, this is one last very important thing. These are the common remedies that I have seen in my practice. Of course, the first remedy is carcinosin, belladonna, lachesis, tarantula, tuberculinum, medorinum, lysine also, remember, for very, very violent kids. Think of lysine, tuberculinum and belladonna, remember. These are the rubrics. Curious, contrary, precocity in children. Remember, the autism savant children, think of the rubric precocity of children. Inclination to make noise. Restless hai bacha, but kaise restless hai wo pucho. Don't take the rubric restlessness. Whether he's jumping, climbing, running in the road, haath chhod ke bhag raha hai. Take that rubric. Don't take the big rubric restlessness, remember. Love for animals, hatred for animals. Medorinum has both. Alternatively, love as well as hatred for animals. Remember that. Traveling and wandering, whether he's traveling or whether he's wandering. Very, very important question. Remember that. Cunning, deceitful, mischievous, hiding. All psychotic miasm symptoms. Remember. Very, very predominant in autism. Destructiveness of clothes, throwing things, biting in children, spitting, pulling hair. These are all meltdowns. Remember, the temper tantrums in autism, they are known as meltdowns. So the number of meltdowns have to reduce after your similar remedy. Behavioral problem in children, again a very, very important rubric. Amusement averse for, amusement desire for, antiques plays, coquettish. A small girl I gave lachesis who was 3 or 4 years old, but she wanted to wear small skirts. Very, very small, short skirts, put lipstick, put nail paint, just like the mother looking at the mirror. Based on this, she was given lachesis, and lachesis really worked very well for her. Caress aversion to, caress desire to be affectionate, disobedience in children, defiant, dictatorial. Just put one video, I'll show you what is self-destruct. Just last one. Okay. Look at what the boy is doing. He's actually tearing himself, remember. The remedy given here was lycinum, remember. Because even the mother had the history of being forsaken, thrown away as a forsaken, and they are, actually treated like a leper. So even Hura comes very close. All the syphilitic remedies here. Okay? Fine. Thank you very much. Sorry, sir. Sorry.